Dr. Glenn Schaefer here. Welcome back to Coffee with the Doc, my podcast where we cover a variety of topics related to wellness and my wellness program, Basic Essentials, where we cover proper exercise, proper nutrition, proper mental, emotional, spiritual well-being, proper rest, proper structure, and purging, eliminating toxins. Today we're going to cover a little bit different topic, some changes that are occurring within the healthcare industry, primarily due to COVID and some of the changes that I have personally seen in the healthcare industry and some of the things that are going to be happening, and that is more virtual medicine, virtual doctor visits, telemedicine, where we're doing an awful lot of things online to help people. So from my side of it, certainly we've been able to utilize some of this, but to give you an example of some of the changes that have taken place because of COVID, prior to COVID, probably about 1% of doctor visits were handled either by the phone, doing a telemedicine, or over a video type of conferencing. During the peak of COVID, probably 45 to 50% of those visits were conducted via telemedicine or on a video type of conference. And out of the people that are utilizing those types of visits, about 85% of them say they'll probably continue to do it that way after COVID. But there are some changes that needed to take place within the medical industry to allow this to take place. And those changes are continuing. They're not going to revert back to what we had prior to COVID. Some of the HIPAA restrictions mandated that we could not interact with patients in certain types of format that wasn't secure enough. So they had to loosen some of those restrictions to allow us to be able to communicate via video chats and telemedicine types of interaction. So those things took place. Additionally, insurance companies had to come up with a way to reimburse doctors. Doctors don't like doing things where they don't get reimbursed for it. So they were real reluctant to want to interact with a patient when they didn't really have a way to code that interaction. So those things took place rather rapidly early on during our COVID pandemic. So we see that. When I looked at some of the demographics on those utilizing telemedicine, video conferencing, obviously the younger generations that are more familiar with technology were utilizing it to a greater degree, but there was a surprising number of seniors who may not be all that adept at utilizing their smartphone. We're willing to learn and to try to have these types of interactions and work with their doctors on these particular areas. Interesting statistic that I also read was that there's about 70% of Americans have some smartphone. So just about everyone can utilize some of the technology that's available out there to help in their healthcare, where they don't actually have to go into the doctor. Some of the different types of this telemedicine, there's obviously real-time, either talking in a video chat or over the phone of some sort with the doctor or a physician's assistant. They have ways to monitor different types of data, as heart monitors, for example, blood sugar, blood evaluations, different types of things along those lines. From a doctor's perspective, we've been able to get a lot of information on our patients via the internet and connecting with other doctor offices, diagnostic tests and studies. We can get that information pretty quickly. And there's an emerging field of artificial intelligence that's being utilized more and more in the medical fields to help diagnose and come up with proper treatments for patients based on the diagnostic data that's available. So we're going to see an awful lot of this. We're going to see this whole area where doctors communicating with doctors, as well as doctors communicating with patients, improve via the internet type of connection, because our technology is rapidly improving. Another area that improved over the last few years was our electronic health records, which is required from all healthcare practitioners need to have some form of electronic healthcare records. Well, those records were in different formats, but that's part of the technology improvements where they're able to connect the formats that different doctors can utilize so that they can speak to each other. So that part's improving greatly. Some of the home treatment that we've seen on the rise, again, we mentioned that face-to-face conferencing or telemedicine where you can speak to a healthcare worker about a particular problem that you're having, but certainly counseling and coaching I've been doing that for quite some time. We're able to teach patients different types of exercise and home treatment that they can do, certainly guide them nutritionally in those particular areas. And all of that is improving greatly. One of the things that I see here that we're able to institute is come up with a variety of conditions that we're able to treat via the internet. So this is going to be a neat area for us where the bulk of a particular treatment for a patient, where they may need to do 2 or 3 treatments per day, that's much more economical if they do those at home versus having to go into the doctor's office. So because of COVID and people not wanting to come into a doctor's office initially, we've come up with quite a few different types of musculoskeletal conditions, from shoulder conditions, knee conditions, back conditions, and be able to help patients in their home. Typically, we still would like to see that patient, and this is another area of telemedicine that has had to change. Prior to COVID, it was quite a poo-poo, if you will. We were trained to never try to diagnose and or make any recommendations without actually seeing a patient. A lot of people weren't going into the homes. And in other words, we put ourselves out at great risk for malpractice type suits if we're doing that because we haven't actually seen the patient. So some of those restrictions and parameters were changed from a legislative standpoint that loosened some of that we're able to do that without greater malpractice type of risk, because obviously we can do a better job of diagnosing and coming up with a treatment if we can actually see the patient and get our hands on that particular patient. But those are some of the conditions that we are utilizing or working on, doing kind of telemedicine, online type of medicine. A big one that we're going to be launching probably this month is neuropathy, which is where a nerve is basically dying, and we have to get that nerve to come back to life. But some of the physical therapy modalities and different things need to be done on a multiple time per day basis, and it's much more efficient if we get the equipment to the patient, train them, and a lot of that training is done online. We will do some in-person training, make sure they're doing it properly, and then there's nutritional support for that patient, as well as some chiropractic care that we can do on a much less frequent basis if they're utilizing the equipment at home. So that's one of the things we're doing. Plantar fasciitis is another one that we're doing. What I mentioned on Coffee with the Doc, my podcast last week, we talked about leaky gut and where there's some intestinal issues of leaking. That's also one that can be treated well from home if the patients do these types of things. My wellness program, Basic Essentials, is another area that we want to utilize, home treatment, get people doing things at home and teaching them how to do that. So a lot of the training for some of these different types of treatments, we're figuring out a way to do it all online where they can have a resource that they can go to, but they can also, we have some monitoring. So if we have patients that are supposed to be doing, let's say, 3 treatments a day, every single day of the week, doing certain nutritional components with that. Now we have an interface that we can communicate with them. We can monitor what they're doing. And if they're not doing their particular treatment protocol, we can get a hold of them right away, talk to them, see what's going on, see if we can help them to get back on track, or maybe they're simply having difficulty interacting and putting information into these monitoring platforms that are available out there. So we have a ton of resources that we're able to do for people at home where they don't have to kind of come into the office. It's a great methodology. It's a great practice that is speeded up greatly during COVID because people didn't want to go into the doctors. And a lot of doctors' offices even closed down. So we have to have a way to help people, and this is going to be a great tool moving forward. I see virtual health in many ways expanding, and we're starting to see drugstores and pharmacies, utilizing some of these different tools to help people. Their websites are becoming much more interactive, where you can actually go on there and chat with healthcare practitioners. We're seeing a lot of insurance companies offering, doctors that you can talk to 24 hours a day, counselors that you can talk to 24 hours a day. Online. So a lot of cool stuff happening. And one of the reasons that it is happening is that people in general are accepting this type of treatment because of COVID and what is taking place. It's speeded up this whole curve of acceptance. A lot of people, even the elderly, are much more willing to do a teledoc, to do some type of online treatment for their particular condition. So I think it's very cool. It's a step in the right direction for many different things. I still personally like to see people, but if there's a way that I could help people that can't necessarily get into the office for one reason or another, I think it's a great tool. Next week, we're going to dive into, on my next podcast, we're going to dive into how do we treat neuropathy in this particular manner. I'll give you some of the details about treating neuropathy, and not only just covering up the symptoms with a pill, potion, or lotion, but actually getting the nerves to heal and to respond and to become healthier and come back to life. The human body is amazing. It's amazingly, wonderfully created by God. If you do good things to the human body, it tends to respond. This is what I tell my patients all the time. We just got to find out what are those good things we need to do, for your body to help it to get well. So that's what we're trying to do. We thank you for tuning in to Coffee with the Doc. Look for that next episode coming up, and we'll talk about neuropathy, how to treat that. Until then, we'll see you then.